I'm talking today to Giselle Malawar. Giselle is a UK Alexander Technique teacher. Hi, Giselle. How are you?
Hi, Joanne. I'm fantastic. How are you?
Wonderful. Giselle, we're going to be having a discussion today about the Alexander Technique, what it is, who can benefit from it. So let's start off with, what is the Alexander Technique?
That's a great question. And I'm always fascinated by the different responses that I get. So I'd like to throw that question back to you out of interest, just to see what you think the Alexander Technique is.
So I think the Alexander Technique is about posture and learning to correct your posture.
Okay, fabulous. So many times people will think that the Alexander Technique is really just about posture, and they'll use their muscles and sit up straight. But it's actually far deeper and far more than just improving posture. It helps to alleviate stress, to reduce pain, whether that's neck pain, knee pain, hip pain, back pain, problems with joints. It's educational, it's preventative and therapeutic. So an Alexander teacher is going to work with the whole person, the whole body. You can't separate mind from body. So if somebody is anxious or worried or nervous about something, that's going to have an effect on the body. Just like, depending on what someone is doing for their profession, whether they're sat over computers all day, whether someone's a coach driver or a bus driver, whether you're in the performing arts playing a musical instrument. So we're slaves to our habits, and we create habits and patterns over a lifetime. So as children, this is a picture is a good example. As children, we have perfect poise, balance, coordination, and that's determined by the head balancing on top of the spine. Now, as adults, what happens is we hold our heads, we stiffen in our neck, the head goes back and down, and then that affects the way we breathe. We have less space in all our joints, we have less space for our organs to function. So basically, as we get older, from teens upwards, we start to hold far more muscle tension in our body. So really, it's about undoing that unnecessary muscle tension, which will then help us when we react emotionally and mentally to things as well.
And can you work with adults or children?
Yes, I've worked with people from all walks of life, all ages. Recently, I was working with a 75-year-old gentleman at the beginning of Parkinson's, and we had about 4 sessions. I gave him about 4 individual one-on-one lessons, about 4 hours of lessons, and he found at the end of that he was able to walk a lot better and sit and stand with more ease. He had much more stability, and that was a very rewarding experience. A lot of the time now, I seem to be getting more calls from parents asking me if I can help with their children's posture. And as young as 12, 13-year-olds, they're asking me about their posture, that they're suffering from backache, and that's quite alarming, but it doesn't surprise me because of modern technology. For example, a few weeks ago, I was at a friend's birthday, and there was a 3-year-old sitting on a sofa with an iPad, bent over the iPad. Now, at that age, why spoil a child's musculoskeletal system? Why spoil the spine, erect the spine when you don't need to? But that's what, unfortunately, modern technology has its pluses, but the downside is the toll will be taken with our spines, unfortunately.
And Giselle, why do you call the sessions lessons? And what happens in a lesson?
Okay, so it's the Alexander Technique is educational, preventative, and therapeutic. What we're doing as teachers is we're giving a person the tools on how they can use to map their body in a different way, so they can use their bodies more efficiently and effectively in everyday activities such as walking, standing, bending, lifting, when driving, when sat at the computer. The Alexander Technique can be applied to when you're at the gym, when you're in the office, in all situations. So it's a lesson because we're teaching a person how to use their body. We're working on the whole person. You cannot separate mind from body. So unlike when a person will go to a doctor or to go just to have a therapy, the person is dependent on that therapist to fix or manipulate the problem. So let's say somebody's got a shoulder problem. So they'll have for example, I'll give you an example. My upstairs neighbour recently gave birth, and she developed a problem in her shoulder. So she started having physiotherapy lessons. It wasn't helping her. I popped upstairs, had a look. I could see the way she was sitting on the sofa, the way she was holding her body. One shoulder was up in the air, one shoulder was down. And it was something that she was doing that was creating the problem, the way she was holding the baby, the way she was feeding the baby. So an Alexander teacher will show, I went up and I showed her to sit on a different type of chair, to put a cushion under her arm so that her arm could be relaxed, her shoulders, her collarbones could widen, that she could lengthen in her spine because her head was just balancing nicely on top of her spine. So it's educational, and through education and awareness, that will prevent the shoulder problem in the first place. Rather than just trying to fix the shoulder problem, then coming home and doing the same thing every day, the problem will just keep reoccurring. So it's coming from another angle, the Alexander technique, and I would say it's very complementary for an Alexander teacher to work with someone that has had physio, chiropractic work, osteopathy. It is very complementary, treating the whole person.
Giselle. Thank you so much for talking to me today.
Thank you. It's been my pleasure. Have a great day.